Antimycobacterial drugs are used to treat infections caused by mycobacteria, primarily tuberculosis and leprosy. Each disease requires specific drug regimens with unique mechanisms of action. Tuberculosis is primarily treated with a combination of four first-line drugs. Isoniazid or INH and rifampin form the cornerstone of TB treatment. Isoniazid works by inhibiting the synthesis of mycolic acids, essential components of the mycobacterial cell wall. This weakens the cell's structure and makes it vulnerable to destruction. Rifampin works differently by binding to and inhibiting bacterial RNA polymerase. This prevents the bacteria from synthesizing RNA and ultimately stops it from producing proteins essential for survival. For multi-drug-resistant tuberculosis, or MDR-TB, second-line agents become necessary. These include fluoroquinolones, which inhibit DNA gyrase, aminoglycosides, which inhibit protein synthesis, and newer drugs like bedaquiline, which targets ATP synthase. Leprosy treatment relies on multi-drug therapy, with different regimens based on clinical classification. The three main drugs used are dapsone, which inhibits folate synthesis, rifampin, and clofazimine, which has both antimicrobial and anti-inflammatory properties. The treatment duration varies based on whether the leprosy infection is classified as paucibacillary, requiring 6 months of treatment, or multibacillary, requiring 12 months of treatment. The World Health Organization provides standardized regimens to prevent resistance development. We'll now discuss the key antifungal and anthelmintic medications and their mechanisms of action. Antifungal drugs target fungal cells through various mechanisms, generally focusing on the cell membrane or wall. Fungal cells differ from human cells by having ergosterol in their cell membranes instead of cholesterol. Antifungal drugs fall into several main classes. Azoles like fluconazole and itraconazole inhibit the synthesis of ergosterol in fungal cell membranes. Polyenes like amphotericin B bind directly to ergosterol, causing membrane disruption and cell death. Echinocandins, such as caspofungin, work differently by inhibiting fungal cell wall synthesis. Allylamines, like terbinafine, are primarily used for dermatophyte infections of the skin, hair, and nails. For clinical applications, amphotericin B remains the gold standard for systemic fungal infections, despite nephrotoxicity concerns. Azoles are preferred for less severe infections, while terbinafine is typically used for dermatophyte infections of the skin, hair, and nails. Anthelmintic drugs are used to treat parasitic worm infections, targeting different types of helminths through various mechanisms. Helminths are parasitic worms that can infect various parts of the human body, requiring specific medications for treatment. Anthelmintic drugs target parasitic worms through distinct mechanisms. Benzimidazoles, such as albendazole and mebendazole, kill helminths by disrupting microtubule formation. Avermectins, like ivermectin, enhance GABA neurotransmission in helminths, causing paralysis. Praziquantel is effective against trematodes and cestodes by increasing calcium permeability in their cell membranes. Pyrantel pamoate is effective against intestinal nematodes by causing spastic paralysis. Drug selection for helminth infections depends on several factors, including the specific parasite species and the site of infection.